let's dive straight into the topic. Ms. Fulle, let me ask you the first question. Tell me, broadly speaking, what has been the effects of the COVID on the mental health of people?
Most definitely, the COVID-19 has had multiple effects on the psychological and mental health of people. To start with, it has had financial, social, and medical as well as psychological effects on people. Demographically speaking, we can categorize people who were affected by this pandemic differently due to their age groups. If we look at the elders who are normally used to socialize with their peer groups in maybe mosques or churches or temples, they were utterly isolated, and this caused a lot of restlessness, anxiety in the elderlies who have never seen or experienced anything like this before. And there is this middle age group who are also the bread earners, who had challenges from every angle. It was job insecurity, it was financial insecurity, it was being the pillar of support for the family members themselves, and going out there into I would say, battlefield to work and to do grocery shopping and coming back home and keeping their family safe. So this was the category who was affected the most, I would say, and they suffered definitely sleep disturbances, appetite disturbances, changes in moods as well, aggression or agitation. Children and teens had their own set of challenges in these times because they were removed from their normative way of living, that is school and playgrounds and going out. So initially they experienced a lot of anxiety, a lot of questions, curiosity, but it is up to the parents and the middle age population to put it at rest, to explain to them how to deal with it. On the other side is people who are already having psychological issues, predominantly who are already diagnosed with psychological issues. Now here is where their challenges really increased, because they were already going through anxiety disorders, depression, panic disorders, OCD, obsessive compulsive, or what we would say even health anxiety. Now, these were the people who really found it very stressful because they couldn't really reach out to get help from their counselors or to get prescriptions even in these times. And their fears actually exacerbated during these times. And those were the people who really went through a lot. And of course, in the end, families who lost loved ones due to COVID-19. They are going through their own traumatized grieving process, which is not the normal grieving process. And I guess they require all the support and mental health that we can provide.
Yes, that's definitely unimaginable. And Dr. Nuhaila, as Ms. Fulle was saying, there are so many restrictions that have been imposed on people. One of the main things is staying at home or restricting movement. So a lot of people are not comfortable with the idea of always staying at home. Initially, it might sound relaxing, but eventually people tend to kind of get bored of it. What do you have to say about that? How do you think people are coping with that bit?
Yeah, I think any change for most of us or all of us is something that we don't like. It's an uncomfortable type of feeling, but in human nature, we're really good at adapting. Some of us take longer than others. I think what has happened is that with the change, with a lot of us having to work from home, we've been forced to look at our simple things like our day and our routines and reprioritize a lot of what we do and how we do. So things have either moved up the list or completely off the list. I think also a lot of that time that being at home has allowed people to revisit and reevaluate and maybe even redefine their purpose. what that is, because it's not just being at home. Your work tasks may have changed because of the COVID situation as well. So there's a lot of different aspects of that have touched on people in different ways. Some people have really enjoyed it. I, for one, absolutely love being at home. No desire to rush back. But I have colleagues that I work with that are finding being at home all the time extremely difficult. We vary in the way we understand the situation. You know, some people are their fears and their anxieties are elevated more so than others. Others have a more pragmatic view of it. If I stay at home and I follow what is asked, you know, all the protocols, then I'm safe. And then obviously you will get those that perhaps don't understand the magnitude of COVID and the risks, or are just rebellious in nature. So I think because there's so many differences in all of us, we're all coping with being at home in different ways. I guess some of us have taken to baking. I mean, there seems to be an influx and a rise on Instagram with all these baking and so forth. Can you hear me all right?
Clearly.
Yeah, and you know, others have taken to do other things. I've had really good conversations even with my sister where it stresses her out, where people feel like they must be utilizing this time to do something very productive, and she always says, I wish somebody would actually say it's okay if that's what you choose, is just to do nothing. If you are happy in that nothingness at home and you're just kind of coasting and you're okay, that's the most important. I think that the mental health at the forefront is the most important thing, and trying to adjust with the new routine and settling into it, and managing your stress levels is the most important thing here and for now.
And it's okay to take a break.
Not to forget, just to add, not to forget that times are changing, right? So it's not once you adapt, that's it. The COVID story and the narrative keeps changing as the days go past and goes by. So you
have to be flexible.
The things that we need to do to change, how we adapt will need to also change. So there's a lot of moving parts.
And it's okay to, as you said, it's okay to sometimes not do anything, because I've read that researchers actually say that if you take a break for some time, it boosts your creativity later. So it's all right.
Yes,
because this is right.
Yeah.
So, Ms. Masrat, as Dr. Nuhaila was saying, she likes to stay at home. She has no complaints. So, there are two types of people, extroverts and introverts. Well, 16 other personality types, but let's just talk about extroverts and introverts. Do you think this time is actually better for introverts because they get to stay in without, and no questions asked?
Okay, so you're asking question about me because I'm an introvert.
Well, we got to learn something new then. That makes two of you.
So, yeah, in a way. So being at home initially, it's been like, you're not confined inside quarters with your family, but also closed inside with yourself a lot. And it takes practice, I think, to learn how to be with, one's own mind without driving yourself nuts. So, but over this time, I have also been reflecting on what it means to stay home and how to find some space inside you when the options of going out are limited. So we just look at it from this perspective that, yes, home is a physical space, but home is also a mental and emotional space where we feel at ease. We rush outside to find something to feel satisfied, but if home is the space inside us that we create for ourselves, and if it's spacious enough, we do not have the need to go looking for much out. And I think that is the most important coping strategy that's worked for me here.